Welcome to the Mass General Weight Center. This presentation is being presented by the surgical nursing staff to help you prepare for your upcoming weight loss surgery. Here is a list of our surgical team. You will meet some or all of these team members before or after surgery. Today we will talk about preparing for your sleeve gastrectomy or gastric bypass, what to expect day of surgery, what to expect during your hospital stay, what to expect in the first 2 weeks after surgery, and what to expect in your first year after surgery. Before surgery, how to prepare for surgery. You will see the registered dietitian for a before surgery or pre-op 1 and 2 group visit. During this visit, the registered dietitian will discuss your diet for the first 2 weeks after surgery, stages 1 and 2, and the vitamins which you start when you advance to stage 3. You will then see your registered dietitian to review the shrink the liver diet, which typically occurs 2 weeks before surgery. This is an individual education session. During this visit, you will review a low carbohydrate diet. This diet helps to decrease the size of the liver to make surgery easier and safer. You will also see a psychologist for a group visit to help you prepare for surgery and for the changes in lifestyle after surgery. You will meet with your surgical team, either your metabolic and bariatric surgeon or nurse practitioner. This is an individual visit before surgery to review surgery and consent. This is also a great time to ask any questions. We encourage you to bring a list of questions to your visit to discuss with us. Next, you will have scheduled a phone call with anesthesia to review your history and current medications. During this visit, please share with them any prior experiences with anesthesia. They will also review your medications. They will tell you which medications to take and not take before surgery. You are encouraged to see your primary care provider before surgery. If you are asked to see a specialist, such as a cardiologist, endocrinologist, pulmonologist, or other specialist, please make sure this is completed before your pre-op, before surgery visit with the metabolic and bariatric surgeon or nurse practitioner. Next, we will review important information for 6 weeks before surgery and lifelong after surgery. At least 6 weeks before surgery, please stop all nicotine use, such as cigarettes, cigars, dip, Zyn, and hookah. Please also stop all cannabis or marijuana use, such as edibles, inhalation, and oils. After surgery, no inhaling any nicotine or cannabis or marijuana. Inhalation of these substances can cause ulcers, breathing problems, infection, blood clots, and other complications after surgery. This is important for your healing and safety. 1 month before and 1 month after surgery. Please stop any estrogen birth control or hormone replacement therapy, including any pills or patch. This can increase your risk for blood clots. If you are sexually active, please use a backup method of birth control. As a reminder, we do not recommend that you become pregnant in the first 12 to 18 months following surgery. This is to allow you to recover from surgery and make sure you are not experiencing any vitamin deficiencies before becoming pregnant. 1 to 2 weeks before surgery. Please start the shrink the liver diet at least 2 weeks prior to surgery or as recommended by your surgeon. This will be discussed in more detail with your registered dietitian. Buy stage 2 foods and liquids. You will find a list on Patient Gateway. This is part of the pre-op 1 and 2 packet. Buy your bariatric multivitamin and calcium supplements. This list will also be in your pre-op 1 and 2 packet that you will receive. If you are on a GLP-1 medication such as Ozempic, Wegovy, Mounjaro, Zepbound, Trulicity, or Victoza, please follow the instructions as per your surgeon. If you take this medication for diabetes, please discuss this further with your prescribing provider if another medication is needed to help control blood sugar levels during this time. Salicylate or aspirin-containing medicines will need to be stopped 1 week before surgery. This includes Aleve, Motrin, ibuprofen, and naproxen. You should also stop all vitamin and mineral supplements unless otherwise instructed. This is due to the increased risk of bleeding around the time of surgery. It is okay to continue with low-dose aspirin up to 81 milligrams if you are advised to take this by a healthcare provider. Anticoagulants or antiplatelets, also known as blood thinner medications, should be discussed with your prescribing provider. This medication includes Coumadin, Eliquis, Xarelto, Plavix, or other blood thinners. The amount of time you need to hold the medication will depend on which medication you are taking. Your prescribing provider will help determine this. 2 days before surgery, the Mass General Weight Center surgical coordinator will call you with your surgery date and time and when and where to arrive on the day of surgery. Please note if your surgery is on a Monday or Tuesday, you will be called Friday afternoon. 2 days before surgery, you should shower with Hibiclens. This will be mailed to your house before surgery. You can use this liquid soap everywhere but your face and groin. Please be sure to focus on your entire abdomen, including cleaning your belly button. This helps to prevent infection. You can also use another antimicrobial soap such as Dial. Please refer to your eRAMS packet, which you will get in the mail and on your patient gateway for more details. Day before surgery. If you have not been taking a GLP-1 medication, you may have clear liquids, full liquids, or protein supplements that go through a straw only. No solid foods. If you have been taking a GL1P medication, please have clear liquids only that you can see through the day before surgery. No solid foods, no full liquids, and no protein shakes. After 10 p.m. on the day before surgery, please have clear liquids you can see through only. No alcohol or solid foods.
Perioperative day of surgery. Carbohydrate drink morning of surgery. Please drink the carbohydrate drink Mass General provides to you. This will be mailed to your home address. This needs to be finished 2 hours before your hospital arrival time. If you are to arrive at 6 a.m., complete this by 4 a.m. If you did not get this in the mail, please drink one 20-ounce Gatorade, any color but red. If you have diabetes, you should not take these drinks before surgery. Medications day of surgery. On the day of surgery, take only medications you have been instructed to take by your surgical team or anesthesia during your pre-admission phone call. Take medication with a sip of water. Day of surgery. Leave all valuables at home. This includes credit cards, large amounts of money, jewelry, laptops, and tablets. If you would like to have your cell phone, please have a friend or family member bring this to you after surgery. If you have sleep apnea, bring your CPAP or BiPAP machine with you to the hospital. Once you arrive, you will meet lots of people. This will include your surgical team, anesthesia, the operating room team, and others. You will review and sign consent forms, verify medical history, allergies, medications, and other important information. An IV line will be started. This is a soft, flexible tube placed inside a vein to give fluids and medications. You will also get a Lovenox injection, as long as there is no reason not to give this to you. This helps prevent blood clots after surgery. Right before surgery. From the pre-surgical area, you will be moved to the surgical area on a stretcher and transferred to the operating room table. In the operating room, you will get set up with safety belts, booties on your lower legs to help prevent blood clots, and given medication through an IV and through a mask to make you sleepy. During surgery. During surgery, a breathing tube will be placed in your throat to help you breathe during surgery. It will be removed before you wake up. You may have a mild sore throat or discomfort after surgery from this. This will go away. Your surgeon will make 4 or 5 small incisions or cuts in your upper stomach for the surgery. Your surgeon will then proceed with the surgery that you had discussed and decided with them at your pre-op visit and had discussed with them day of surgery when reviewing and signing your consent form. This may include a Roux-en-Y gastric bypass, sleeve gastrectomy, or other procedure. Post-anesthesia care unit, the recovery room. After surgery, you will start to wake up in the recovery room. In the recovery room, you will be monitored frequently for blood pressure, heart rate, oxygen level, temperature, nausea, and pain. Once everything looks okay, you will be transferred to home hospital or to your hospital room, usually 2 to 3 hours after surgery. The option of home hospital will be discussed with you and your providers if you qualify for this. Bariatric unit or home hospital same day after surgery. Pain. Pain is normal and expected. You will get medicine to help lessen but not eliminate pain. IV. You will get IV fluid for hydration and medicine for pain and nausea. Diet. Start sips of water the evening after surgery. Aim for 1 to 2 medicine cups per hour. Activity. Try to get up and about out of bed the same day after surgery to help with recovery. Breathing exercises. Use an incentive spirometer 10 times per hour while awake. This will be reviewed with you with the hospital staff and care team. Bariatric unit or home hospital a day after surgery. You will continue with all of the previous activities on the last slide. Sips of clear liquids. Be sure to drink about 2 to 3 full cups, 8 ounces each of clear liquids before discharge. Do breathing exercises using the incentive spirometer and walk around the room or unit or your home. If everything looks okay and you're able to drink enough clear liquids, you will go home in the late morning or early afternoon or be discharged from home hospital.
After surgery, after discharge from the hospital. Home, the first 1 to 2 weeks following surgery. It is normal to feel tired and fatigued for several weeks after surgery. Continue doing breathing exercises with the incentive spirometer at home if one was provided to you. Post-op call. The nurse will call you about 2 to 3 days after you leave the hospital to see how you are doing. Diet. The second day after surgery, please start the stage 2 bariatric diet as previously discussed with the dietitian. Continue to follow this until your advance the diet group visit with the dietitian. Do not change your diet on your own. Restrictions. Do not drive for about 3 to 4 days following surgery or while taking narcotic pain medication. You should also avoid heavy lifting or strenuous activity for 4 weeks after surgery. Do not lift anything heavier than 10 pounds, which is about the same as a gallon of milk. Incision care. You will either have Dermabond surgical glue or Steri-strips in place over your incisions. You will not have any visible sutures or staples. The surgical glue and tape help keep the incisions closed while they heal. Please leave them on for 10 to 14 days. If they fall off on their own before that time, that is okay. If you have bandages over your incisions, you may remove them and shower 2 days after surgery, but should avoid tub baths or soaking in any water until the incisions are well healed. Do not put lotion, creams, or powders over the incisions for 4 weeks. You will be sent home with the following medications after surgery. Omeprazole or Prilosec. You will receive a 30-day prescription for this. Please take this medication every day to help with healing, even if you do not have reflux. After 30 days, you can stop taking this as long as you have not been told by another provider to continue it. You will be given a prescription for ondansetron, or Zofran. Please take this as needed for nausea. You will also receive a prescription for Miralax, which is a laxative. If you have not had a bowel movement within 2 days after surgery, you should start this medication. Pain is a normal and expected part of any surgery, but you will receive medications to help lessen, not eliminate, your pain. You should take 1,000 milligrams of acetaminophen, or Tylenol, every 8 hours for the first 2 days, then as needed. If you have the sleeve gastrectomy, you can also take an NSAID, or nonsteroidal anti-inflammatory drug, such as ibuprofen or Aleve as needed, but this should not be taken on an empty stomach. You can alternate the Tylenol and NSAID for better pain control after the sleeve gastrectomy. However, do not take NSAIDs if you have a gastric bypass. Narcotic pain medication should only be taken for severe pain not relieved by other medications. Tips on nausea and vomiting. Nausea can occur after surgery. If you have nausea, there are a few things you can try. First, try to drink more fluids. Dehydration can worsen nausea. You should also drink salty fluids, such as broth, tomato juice, or condensed tomato soup. Take ondansetron, or Zofran, the medication that will be prescribed for nausea as needed. If you are unable to meet your fluid goals because of nausea, constipation, or stomach pain, let the surgical team know. Since the new stomach is smaller, it will not be able to hold as much as it used to. Vomiting may happen if you drink past feeling full, drink too much at once, or drink too quickly. If you have continued vomiting, please let your surgical team know. How to dispose of unused pain medication. If you have any unused narcotic pain medication, there are a few ways you can safely dispose of them. You can bring them to a medicine disposal station in your city or town, or you can drop them off at one of the MGH medicine disposal bins listed. You could also crush the medication, mix it with used coffee grounds, and place the mixture in the trash. Please do not flush leftover medications down the toilet. 4 weeks after surgery. 4 weeks after surgery, you can stop taking omeprazole unless told by a provider to continue with it. You can also resume regular physical activity. Both aerobic activity and strength training are recommended, but be sure to start off slow and gradually increase as tolerated to avoid overdoing it. After surgery. The first year after surgery. You will have frequent follow-up visits in the first 18 months after surgery to monitor your progress. Blood work will be ordered and should be done prior to these visits to monitor for any vitamin deficiencies. You will also have scheduled individual and group follow-up visits with the dietitian and psychologist during this time frame. As long as you are doing well after 18 months, you will be given the option to follow with your primary care provider for annual blood work, or you can continue to follow with us annually for blood work and monitoring. Long-term recommendations after surgery. As a few reminders, vitamin and mineral supplements need to be taken lifelong. You should also avoid smoking, vaping, or inhaling of any substances to avoid complications or irritation to the lining of your stomach. If you have the gastric bypass, you need to avoid nonsteroidal anti-inflammatory drugs, or NSAIDs, lifelong. Fertility can improve with weight loss, so be sure to avoid pregnancy for 12 to 18 months after surgery. Since you will need to hold any estrogen-containing products for a month before and a month after surgery, please use a backup form of birth control as needed to prevent pregnancy during that time. To ensure you stay well hydrated, you will need to drink at least 64 ounces of hydrating fluids daily. How to contact the surgical team. Let us know if you have any questions or concerns after surgery. For questions or concerns during the week, please call the bariatric surgery registered nurse at 617-643-6150. For urgent issues after 4:30 p.m. during the week, overnight, on the weekends or holidays, please call 617-726-2000 and ask the operator to page 20377. Please bring your questions to your pre-op appointment with the metabolic and bariatric surgeon or nurse practitioner. We are here to help.